Uganda Cancer Institute, the Center of Excellency for Oncology, is to embark on a project of cancer registration to help it be able to collect data on people who catch the disease. The common types, people who survive after getting cancer and those that die. While speaking to a delegation from countries under the East African Community, oncology specialists from Uganda Cancer Institute said data is very important in controlling the disease. Registration will help in planning for the cancer because they all have different preventive mechanisms.
That we agree on how we shall be reporting on cancers to give us an idea as a bloc of East Africa that this is the burden of cancer.
In Uganda and Tanzania, 60% of the cancer patients go to hospital, while in Kenya, they are less than 15%. This attributed to people believing that this disease is not curable.
10 years ago, people were only spending a year with cancer. Having put radiotherapy, there's so many oncologists, their trainings, we want after 10 years that now the survival has increased from 1 year to 5 years, and they are having good quality of life without symptoms, without bleeding, without pain, and so on. So you cannot get all that measures unless you do population-based cancer registration.
How do you manage this? Because most of the cases they come with a diagnosed one. Do you have your separate lab that also just confirm this again, or?
Accordingly, number one cancer is cervical cancer. Most countries in the region use HPV vaccine to prevent cancer, although in Uganda, the uptake is poor. An oncology consultant in Uganda Cancer Institute says 50% of cancer patients, including those with brain tumor, will require radiotherapy. Delegates were, however, inquisitive to know how a patient can be on chemotherapy and at the same time herbal medicine. A consultant in oncology, Dr. Fred Okuku, says they discourage it. However, some local medicines are good to treat the symptoms of the cancer. Uganda Cancer Institute warns patients against the existence of conmen who claim their medicines cure every disease.
Act with each other. So you tell me, take this with your cancer medicines. How will I know? How will the interaction be? Will I be able to eat food? What are the side effects? Will I lose blood? The guy will not tell you any of this. So, because of that, I would not recommend anyone to use that while on chemotherapy. There is one patient who died because she went and got an IV herbal while I had also given IV chemotherapy treatment.
The delegates toured the ongoing constructions that will house clinical work, ICU, and one for academic research. They also saw other radiotherapy machines in Uganda Cancer Institute. Going forward, the institute plans to start trainings in nursing and surgical oncology, plus research on viruses that cause cancer. I'm Navka Farida and Helen Barbara in Mulago.